Hi, I'm Dr. Sharifa Baker with CHRISTUS Primary Care Specialist. I am originally from Chicago, Illinois, but at age 10 we moved to Houston, Texas. So the majority of my childhood I grew up in Texas. So truthfully, I claim Texas as my home state. And Houston, as you know, is a rustling, bustling city. And it was a great childhood. My family of cousins and aunties and siblings all live within a 5-mile radius. We spent every holiday, every weekend, every moment that we could together. Our lives are just centered around spending time together, and I think that's why I'm so connected to family, and maybe why I even chose family medicine as my career. There are two people who've had an influence on me, my mother and my grandmother. Both of these ladies were instrumental in teaching me about compassion and how important it is to give back and help others. They were both sacrificial and gave up everything that they could to make sure that they could do what they could to help other people in their community. I chose a career in medicine after a long, arduous battle with vacillating back and forth with decisions between engineering, physical therapy. I really loved science and math, and then I decided that I really didn't want to have a career where I didn't touch people. As I said, I wanted to be able to use the gift of compassion and touching and healing and helping people. And early in my college career, my grandmother, who was so instrumental in my upbringing, she passed away. And so what I decided was that I wanted to put those gifts to use. And so I had a mentor who helped me see that medicine was the way that I could best utilize those gifts. I love family medicine because I get to work with the generations. I get to see people from the time they start out in puberty through their first, dates, through the high school years, through the times that they get married, and up into their senior years. And I work with families. So I see them through all of their challenges, and I feel like I'm part of their family. And I think that's the essence of family medicine. The greatest philosophy that I have in patient care is to provide a preventive aspect to medicine. I think that adding a preventive medicine component to my patient's armory, I guess I would say artillery, to help them not have a disease problem and learn how to prevent disease is the best way to keep them healthy. I want them to avoid hypertension, avoid diabetes, avoid those conditions, and I help teach them ways that they can prevent getting those problems. And so I think by educating my patients, they appreciate that. I'm very honest with them, and I walk side by side and help them to become empowered, and I encourage them, and I feel like I'm more of a friend and a doctor.